Hi.
Good morning. How are you doing this morning?
Great.
Great. So, Michigan Mama News appreciates your time this morning, and we're talking about, risk of hepatitis A. So, I guess, tell us about hepatitis A, and is it highly contagious? Give us some background on that.
Yeah, absolutely. And hi, this is Dr. Leonard Friedland, vaccine researcher at GSK Vaccines. So hepatitis A is a highly contagious virus that targets the liver. Now, this virus can be spread from person to person and also through contaminated food and drink. And people can be spreading hepatitis A before they develop any symptoms of hepatitis A. And that makes essentially all of us get risk for hepatitis A infection.
So, right now, who is at risk?
Well, essentially, we're all at risk for hepatitis A infection because, again, the virus is spread from person to person and can also be spread through microscopic amounts of the virus that can be in contaminated food or drink. Now, there are certain high-risk groups that are recommended for vaccination, and those include people with chronic diseases, people who use drugs, people who have unstable housing, people who are traveling and could be at risk for hepatitis A where they travel, and also men who have sex with men. The important thing is that the best way to prevent hepatitis A is through vaccination, and anybody who wants to protect themselves against hepatitis A can be vaccinated. Now, in the wonderful state of Michigan, there's been outbreaks of hepatitis A. In fact, if we step back nationally, there was a period of about 20 years where there were fewer and fewer cases of hepatitis A across the United States. But beginning in 2016, we've reversed that trend, and we now have had 33 states that have had outbreaks of hepatitis A, including in Michigan. In fact, in Michigan, 70% of people with hepatitis A have been, actually it's 80% of people with hepatitis A have been hospitalized due to their hepatitis A infections.
That's interesting. There's just so much going on right now for everyone to think about.
Absolutely.
That's for sure. So, what are the symptoms?
Yeah, the symptoms include fever, yellow eyes and skin, nausea, vomiting, diarrhea, lethargy, joint pains. Hepatitis A can be fatal, and as mentioned, 80% of the hepatitis A cases during the outbreak of hepatitis A in the state of Michigan have been hospitalized. But the good news is that hepatitis A is vaccine preventable. Only 15% of people, adults in the United States, have received the first recommended dose of hepatitis A. So there's a lot of people who can be vaccinated against this particular disease. July 28th is World Hepatitis Day. And so this is an opportunity for us to remind ourselves of the importance of protecting ourselves against hepatitis A, because anybody who wants to protect themselves against hepatitis A can be vaccinated, and in fact, most insurance plans cover hepatitis A vaccination.
Well, I know a lot of people are on the fence for getting vaccines, and right now, and who should get the vaccine?
Yeah, I understand that sentiment as well. I would also say that it's really important, especially in today's environment with the COVID pandemic, to do everything possible to keep ourselves healthy. So first off, that includes good sanitary practices, washing our hands carefully when we're around sick people, washing our hands carefully when we're handling food and drink, keeping distance from people who have signs and symptoms of any illness. Those are good practices that also play a role with hepatitis A because it can be spread from contaminated food and drink. As far as people being vaccinated, in addition to children, when we look at adults, should mention that during the COVID pandemic, adults have decreased their rates of vaccination by 67% for the recommended adult vaccines. So it's really important that we speak to our doctor, our pharmacist around not only hepatitis A vaccination, but all the other vaccines that are recommended for adults. When it comes to hepatitis A vaccination in particular, since you asked about that, here the recommendations are for people who have suffered from chronic illnesses, people who use drugs, men who have sex with men, people who are experiencing unstable housing, people who are traveling and want to protect themselves against hepatitis A, and anybody who wants to protect themselves against hepatitis A can be vaccinated, and most insurance plans cover hepatitis A vaccination.
So where can we go for more information?
Well, I always say the best place to start is to speak to your doctor and speak to your pharmacist. Hepatitis A vaccinations can be given not only in the doctor's office, but also in your local pharmacy. So speak to your doctor, speak to your pharmacist about hepatitis A vaccination, but also about all the other vaccines that are recommended for adults. And if you want to learn more, a good website to go to, in fact, a great website to go to, is cdc.gov/vaccine. So I'll repeat that, cdc.gov/vaccines, to learn about hepatitis A, the disease, hepatitis A vaccinations that are recommended for adults, and also all the other vaccines that are recommended for adults. And that's really important right now because we want to do everything we can to keep ourselves healthy in today's environment. And again, World Hepatitis A is coming up on July 28th, so a great reminder to protect ourselves, learn about hepatitis A disease and vaccination.
Well, is there anything else we didn't cover in this interview you wanted to mention?
Well, just to summarize again, it's really important to do everything we can to keep ourselves healthy today. So in addition to good sanitary practices, washing our hands carefully, learn about hepatitis A vaccination, speak to the doctor and the pharmacist, and also ask them about the other vaccines that are recommended for adults, since adult vaccination rates have been dropping down during the COVID pandemic, and we want to do everything we can to keep ourselves healthy as we move through the summer into the fall.
Thank you for your time today.
Thank you.